The Caya Diaphragm. Hello, welcome to our video series on contraceptive methods. In this video, I am going to show you the Caya Diaphragm and how to use it. A diaphragm is a flexible cup used with contraceptive gel that a woman puts up inside her vagina before sex to prevent pregnancy. The Caya Diaphragm is easy to use and comfortable to wear. Neither you nor your partner should be able to feel it. It's a natural and safe method that you have total control over. And you can get one without going to a clinic or having an exam. The diaphragm works by covering your cervix to keep sperm from getting you pregnant. It's good at preventing pregnancy, but it's not the most reliable method. If it's very important for you to avoid pregnancy, choose a more effective method of contraception, such as the implant, the IUD, or the injection. You need to use the diaphragm every time you have sex. You can use it with any kind of water-based contraceptive gel. Always put the diaphragm inside you before the penis enters your vagina, no matter what. The contraceptive gel goes in the cup that fits up against your cervix and adds extra protection. There are little bumps on each side to help grip the diaphragm. Squeeze it together to insert it, putting the rounded rim in first. This little indentation fits your fingertip and makes it easy to pull the diaphragm out. It's easy to learn to use the diaphragm, but you need to be comfortable putting your fingers inside yourself. It comes in one size that fits most women. Practice putting the diaphragm in and taking it out until you're comfortable. This will give you the confidence you need when you are in the moment. Here's how. First, wash your hands. Then, check the diaphragm for holes. Next, add contraceptive gel. Hold the diaphragm at the two bumpy places. Pinch it together and place a line of contraceptive gel in each of the two folds. And a little on the rim to help it slide in easily. Choose a comfortable position, such as lying down, standing with one leg up, or squatting. Now, get familiar with where your cervix and pubic bone are. Put your first or second finger inside your vagina and feel for something round and smooth. Your cervix feels firm like your nose. Then, move your finger forward to feel the hard pubic bone. Now, put your diaphragm inside. Separate the lips of your vagina, then pinch the diaphragm so it's long and narrow. Insert it with the rim end first, in the direction of your tailbone. It should slide in soft and easy. Push it all the way in, as far as your finger can reach. Then push the front edge up and tuck it behind your pubic bone. Now, feel for your cervix within the diaphragm. If you don't aim the diaphragm toward your tailbone, it may not be positioned in the right place. If your cervix is not covered, take the diaphragm out and try again, aiming the diaphragm towards your tailbone. Your finger may not reach your whole cervix, but you should have a good sense that the diaphragm covers it completely. You're now ready for sex. If more than 2 hours passes before you have sex, Be sure to put more contraceptive gel inside your vagina.
with the applicator. And then you don't move the diaphragm. The diaphragm stays in and you add, and then once it's
After sex, leave the diaphragm in place for at least 6 hours.
after you've finished having it
If you have sex again, don't take the diaphragm out. Instead, insert more contraceptive gel into your vagina before having sex. And wait 6 more hours, the time it takes for sperm to die.
in there. But, however, don't
Be careful not to leave the diaphragm inside longer than 24 hours, or you could get an infection.
you could get an infection if you leave it in for more
To remove the diaphragm, hook your finger into the little indentation and pull it out. Then clean it with soap and water. Let it air dry in its open case and store it. It's reusable for 2 years. The Caya diaphragm fits most women. How can you tell if it fits you?
So you're going to hold the sides together.
If you are able to insert the diaphragm, it completely covers your cervix and the front rim is securely behind your pubic bone. The diaphragm fits. If the diaphragm is too large, you may not be able to insert it completely and it will be uncomfortable.
Position and they can feel it.
If it's too small, it won't fully cover your cervix.
It's covered. This
If the diaphragm doesn't fit well, don't use it for contraception.
diaphragm just won't cover it.
After giving birth, you can start using the diaphragm after 6 weeks.
Perception, especially if you
If you forget to use the diaphragm and have sex,
on a shelf
remember to take emergency contraception.
and prevent you from pregnancy.
You can use condoms together with the diaphragm to make the diaphragm more effective and protect yourself from sexually transmitted infections, including HIV. Only condoms do that. Keep these points in mind. Insert the diaphragm in the direction of your tailbone. Push it all the way in and tuck it behind your pubic bone. Check to be sure the diaphragm covers your cervix. Learn all you can about your contraceptive method so you feel confident and safe and become pregnant only if and when you want to. You're worth it.